Very good morning, doctors. So welcome to another PYT session of medicine. So actually this is not taken into medicine, but still previously I have already discussed there will be a integration of medicine with anatomy with surgery. So this is kind of that type of integration. So let us get into the topic without making any delay. I don't want to waste your time. So let us get into the topic. So the question is about Barry aneurysm, right? That is Barry aneurysm. Now, what is the question? The most common site of Barry aneurysm is it posterior communicating artery? Say this is posterior communicating artery. Sorry if I have written shortcuts, but it is posterior communicating artery. Now, posterior communicating artery or posterior cerebral artery or middle cerebral artery, MCA means middle cerebral artery, or anterior communicating artery. Now, what is the answer? Most common site of Barry aneurysm. I think most of you might have got the answer, but you will not get the question like this. That is the surprise. You will not get the question in this direct manner. No. Don't expect question like this. You will not get the question like this. Okay. But anyhow, so I think you all know what is the most common site of Barry aneurysm. I think after the explanation we will get to the answer. Okay. So actually, first, what is meant by an aneurysm? I want that answer. It is the dilatation of blood vessel. Dilatation of blood vessel. Right? That is called as aneurysm. Now, if you just ask me what actually, at which point the aneurysm generally most common site for aneurysm, we will just check here. Okay, for that we will just draw a little bit of diagram. Okay, we should draw the circle of Willis. Okay, wait. Oh shit. No. Wait. We'll just draw this afterwards. Until then, we will draw this one only. We will just draw the blood vessels first. Okay. See, don't think like I'm wasting your time, but trust me, it will really help you. Don't think like that. Okay. This will help you. Right, so I think we'll join here, and this one we have one more branch, and it will get on to communicating as this lower main segment artery. Okay, I think we'll have a branch here. What is the branch? Anyone here? We will have one more branch, come like this. Okay. Now this is just a rough diagram. We'll just discuss the main sectors. Okay. Now this vessel is, what is this one? Anterior cerebral artery. It is anterior cerebral artery. Then what is this one? That is anterior communicating artery. See why I am just writing all this nonsense? Because you will get the diagrammatic question, that is image based question. Don't expect direct questions. Okay, now this is middle cerebral artery because it is in the middle towards the cerebral region, so middle cerebral artery. Okay, now this one is, if the top one is anterior, obviously this one become the posterior communicating artery, and the top one is anterior cerebral, so obviously this one become posterior cerebral artery. Now what are these large arteries here? See, both sides bilateral you have large arteries. What are these arteries? These are internal carotids. Now, what is the most common site for berry aneurysm? It is the junction. It is the junction of anterior communicating artery and the anterior cerebral artery here. This is the most site for causage of berry aneurysm. Right now, what percentage it forms? Something like 40% of all the aneurysms occur at this point. After that, it is followed by the second most common site is middle cerebral artery. It will form here, middle cerebral artery. How much? 34%. Followed by posterior communicating artery. Posterior communicating artery. Which site? Here. Posterior communicating artery. That is nearly, it forms 20%. I mean, sorry. Not that one. So the next point is here 34%, and the second one is posterior communicating artery, that accounts for nearly 20%. Here, sorry, not there, here, that is for nearly 20%. Now the next one is posterior cerebral artery, that accounts for nearly, here you will see that is 4%, because it is the posterior cerebral artery, right? Now what is this large one? I think I did not write this one. This is basilar artery. This is basilar artery. Okay. So just remember one thing, about 85 to something like 90% of aneurysms, they occur in the anterior circulation of circle of Willis. Remember, anterior circulation of circle of Willis. Nearly 80 to 90% of the aneurysms, they occur in anterior circulation on the circle of Willis. Now, so the common sites we will see in the junction of anterior communicating artery and the anterior cerebral artery. So this is the most common site. So rest of the things I think you understand now. What is the most common site? You remember this diagram. This is very important. Okay. Now just remember one thing. What are the most common aneurysms you see in the anterior communicating artery or anterior cerebral artery? In men. If you ask in men, the most common type of aneurysm is saccular type of aneurysm. But if you ask me in women, the most common type of aneurysm, right, in women is which one? That is also saccular aneurysm only. Don't bang your heads. That is also saccular aneurysm. But there is a difference in the anatomical site. Remember, this one is important. In men, mostly it is seen at anterior cerebral artery or anterior communicating artery. But whereas in women, the most common site for saccular aneurysms is, it is the junction of the ICA, that is internal carotid artery, with the posterior communicating artery. Posterior communicating artery. Now this is the most common site for women for the causing of saccular aneurysms. Obviously the anterior part holds the main key site for the aneurysms. Now bifurcation of middle cerebral artery as well as the bifurcation of basilar cerebral artery as well as bifurcation of internal carotid artery. These are the common sites for aneurysms. Okay, so this is all about the common site. We will come with a even more better PhD topic. Thank you.